I do want to welcome everyone here, and again, Happy New Year to everyone, and to a healthy and happy 2025. There's still some remaining data to analyze, but currently projecting that the number of fatalities will not rise above 85. Fentanyl still remains a chief concern, as 70% of these deaths involve the drug of some shape or other. Fentanyl in 2019 was 74%, so we did see a 4% decrease from the earlier numbers pre-COVID. But again, nothing to take victory laps about. And this is great stuff that we're doing, and our departments are out there doing great things. But again, we can't let our foot off the gas. While this progress is a step in the right direction, it's also a call of action. We must fight even harder, doubling down on addiction prevention, education, treatment, recovery services, and working with insurance companies who say to people, oh, we have a bed for recovery for 5 days or 7 days. I don't know about you. Who the hell can get help in 7 days, right? It takes you time to get over the jitters, the withdrawals, wanting to have that addiction need, and then the insurance company goes, sorry, you're out. You're lucky to get 30 days. You're lucky to get beyond 30 days. And I will say to the federal government and to everyone else, that needs to change. We need to give people out. And sometimes when they do 180 days, they need another 180 days. Life just doesn't change. They come out and say, hey, boom. And these halfway houses, one of the things we need to pay attention to, more of all the halfway houses, do you know where drug dealers are waiting? I guarantee you, if you go to any halfway house anywhere in this state and you walk out that door, them drug dealers are waiting for you to come out of that house and say, hey, we got your fix. You can't have that. It doesn't stop. So when they get back on the street, we got to make sure that the bad actors that are selling the drugs aren't there. You go to the fentanyl on Central Avenue. Go out there. There's drug dealers out in the parking lot selling, even though they're getting their fix to help them get off of it. There's someone there selling the real product. It doesn't stop, and that's the point that I'm making to you. That's why I'm proud to announce that we're investing over $1.5 million in opiate settlement funds into a series of new initiatives and staffing positions throughout the county. Mental health department will be investing over $436,000 in with a part-time nurse that's going to be a medication for opiate and introduction or to treatment. So we're going to have a part-time staffer at our mental health to help people with addiction so they can talk to them and get them through it. To enhance the impact of the Mobile Outreach Treatment Overdose Response Unit, also known as MOTR, we'll expand with a second team extending service hours and reach. The other important thing is, because we do want to be the greenest county in the state of New York, is that we're adding 2 new electrical mobile office vans that will be effectively doubling our outreach into the community and doing it in a clean way, which is so awesome. And then raise awareness through community events and with the Narcan and the wounded care kits to support prevention efforts. Our Department of Health, we're spending more than $619,000. Increased with, like I said, the public education, prevention campaigns, improving data collection and management, and expanding the opiate crisis response staffing, which is crucial. Increase harm reduction resources, such as I was saying earlier, the Narcan housing units and equipment, connecting at-risk persons for treatment, including post-overdose response kit supplies. Providing overdose spike alerts, following us to identify fatal overdoses faster, and responding to them through the Mobile Outreach Treatment Overdose Response Unit, which I talked about too, faster, more efficiently, and issuing warnings to the public about a possible fentanyl contamination. At the Albany County Crime Victim Sexual Violence Center, we're spending $200,000 on hiring additional staff to promote opiate use disorder education prevention through the community, providing education regarding how to trauma history and contribute to substance and self-medication following trauma experience. We are investing more than $260,000 on a new data management system to improve data collection, organization, and case management. So I do want to thank them for that. Adding additional staff members to their office to facilitate the influx of cases involved with the opiate crisis, and improving the workflow.
This has been a long struggle, and it is not anywhere near as over. But the way I get through each day is to try to find reasons for hope, and I think there are many here. Albany County is unique, I think, in its commitment, undying commitment to folks struggling with behavioral health problems, addiction, and mental health. Just as a point of information, there are, last we checked, about 2,000 folks in treatment for addiction in Albany County right now. Those are 2,000 people who, although we focus on fatality information, which is important, those are 2,000 people who are not overdosing today, 2,000 people who are getting care and treatment. There's at least that amount in our mental health system that are working towards improving the quality of their life. And that's because of our partnerships, as the county executive always talks about. We don't get to solve these problems alone. Our partnerships with our community stakeholders and providers. Some of you know that in May we put out $2.2 million from this same fund to our community agencies after we reached out to them. What do you need? What can we do to help you?
You know, I'm delighted to see that our leaders in Albany County, our commissioners, and the county exec are thinking very strategically. It's not just about placing, you know, a case manager or social worker. It's also about the backup and the supplies and the programmatic elements that they need to launch this program. So I was really glad to see how thoughtfully this list of grants to the departments has been laid out. Just want a final note. As we look into 2025, the legislature, working with the county exec and our other county leaders, we are going to continue to work on other pieces to I think, this public health crisis and this battle. And one of them, I just want to remind us all, one of them is trying to do that addiction prevention education at that front end. And Dan talked about this, and it's so important. It is trying to get to young people, kids in middle school, even elementary school, definitely high school, and trying to put into place in our schools through our PTAs and PTOs and through our school groups, trying to put into place addiction prevention education programs that start to chip away at the entry point for these kids.
So I do thank our county executive, and I do thank you, Dr. Giorgiano, for all of the work that you have done. But I also thank those people that work in our mental health department, that works in our health department, who try so hard each and every day to manage without enough money to combat this issue that faces us. So yes, we do look to law enforcement too, and realize that there's so many different branches that we need to fight this war on drugs that is so easily distressing our communities. So yes, today, as you look at how we are spending this opioid settlement funds, I want you to look at the programs very deeply on what they really do involve, and to let you know that we have made a commitment and an investment.
We should really be addressing these problems in a proactive way, and that's why I'm just so thrilled to find out about this and to know that the county is putting forth resources to make sure that we treat addiction right away, and that we're helping the men and women and the families who are dealing with these problems, because this addiction problem is one of those things that cuts across race and class, and it affects every neighborhood in Albany County. And the work that Albany County has done up to now is amazing. This money that they're going to put forward, I can't wait to see what we can do to help with these efforts. And I just want to let everybody know I'm really excited to be standing up here and to be a part of this, and whatever my office can do to help, we're going to do it. So I just want to thank the men and women behind me for being the example of how to take care of the citizens of a county.
Thank you so much. Thank you to everyone here.